Hi guys, this is episode 2 of our series on the A to Z of COVID, and we're going to begin from the origins of the virus. This is the letter B and bats. Well, why are bats important? Well, of course, they're known to be the cause of the coronavirus itself. Now, we know bats are natural carriers of coronaviruses, and COVID-19 probably started in a Wuhan wet market when a bat and a pangolin were kept in close proximity to each other. SARS and MERS are linked to coronaviruses. We've seen that in the movie Contagion, there's a link between a bat and the virus spreading. The other theory, of course, on the origins of the virus is linked to the Wuhan Institute of Virology. That seems a little bit conspiracy theory-like. I'm not quite sure I believe that, but we'll stick with the bat theory for now. Right, moving on to something more meaningful. We've gone on to BCG. Now, what is BCG and why does it sound so familiar to all Indians? Well, BCG is actually the vaccine for tuberculosis. And in a country which is so heavily ravaged by tuberculosis as ours, it is very important that we understand this. Why is tuberculosis connected to COVID-19 and what can it do and what does BCG have to do with all of this? Well, first things first, there was a study that shows epidemiological evidence that successful long-running BCG programs can actually lower mortality rates for COVID-19. What that meant was people who were given BCG as children, and most countries obviously have childhood BCG vaccination programs. You remember it from the big scar that you always have on your arm. Most people in India do get BCG vaccines as kids. What that meant was that, and according to other research done by researchers into the BCG vaccine, childhood BCG actually protected against other diseases, what they called off-target effects, not just inoculating yourself against tuberculosis. Now, their assumption here is that non-specific effects could prevent severe COVID-19. And their epidemiological study has found that places like Italy and Iran, which either didn't have a universal BCG vaccination program for children or instituted it much later, Iran did in 1984, had much higher mortality rates as compared to places like Denmark and Japan, which both instituted these BCG vaccination programs in the mid-1940s. In addition to this, Texas A&M University in Austin is actually running a clinical trial on the efficacy of the BCG vaccine against COVID-19. Healthcare workers are going to be the first to be given the vaccine. WHO, however, still believes that we don't have any clear evidence, and until we have clear evidence on the efficacy of the BCG vaccine against COVID-19, then it should not be used. And from the brilliant to the completely bizarre. Now, Brazil, for starters, had a BCG vaccination program that began in 1920, but it has one of the highest mortality rates of the COVID virus anywhere in the world. And that is down almost entirely to their response to the virus. Jair Bolsonaro, the president, believes that COVID is a hoax. He called it a little flu in one of his press conferences. He's rejected any quarantine, any lockdown measures, and already fought with members of his cabinet over it. His health minister, Mandetta, was sacked for actually enforcing a lockdown. Sao Paulo and Rio governors have defied Bolsonaro and have introduced lockdown measures. There have been protests against him. The actual number of cases in Brazil is 12 times higher than reported. It's the highest in South America. And to top it all off with a nice little cherry on the cake, mass graves in Manaus and their main cemetery burying 5 coffins at a time. If that isn't scary, and if he shouldn't backtrack on what he has said, I really don't know what the world has come to. So, in conclusion, just remember 3 things. Bats could be the origin of the virus and they're natural carriers of coronaviruses. BCG is very important because its off-target effects could prevent a severe COVID-19 response from your own body. There are trials running to ascertain the efficacy of the virus, but as of yet, the WHO has not said you should use it. And Brazil has gone cuckoo because their president believes that the virus is a hoax.